Hey everyone! Today's lesson from ACLS Certification Association is on Systems of Care, Out-of-Hospital Cardiac Arrest. Don't forget to visit us online at aclscertification.org to certify or recertify your ACLS, PALS, BLS, or NRP 100% online. Now, let's get started. Systems of Care, Out-of-Hospital Cardiac Arrest. Communities combating cardiac arrest. In the United States, out-of-hospital cardiac arrest, or OHCA, has an incidence of 132 per 100,000 people. There is a need for communities to play a greater role in the fight against OHCA. Local government leaders and non-governmental organizations must lead the way by training laypersons to provide bystander CPR and early defibrillation to increase resuscitation success rates. The goal is to provide these life-saving interventions as soon as the cardiac event takes place to increase the rates of survival. The community plays a big part in the OHCA chain of survival. Community involvement in OHCA. The community, as part of the chain of survival, is an invaluable stakeholder in rescuing victims of cardiac arrest. Bystander CPR can be taught to anyone, even children. With limited access to equipment, a layperson can provide highly effective hands-only CPR if conventional CPR provided by trained healthcare providers is not readily available. Traditional face-to-face instruction with demonstration and practice is required to train bystanders to perform CPR. However, self-instruction media is also acceptable depending on the participant's requirements. Some governmental policies have approved training of high school students, volunteer members of the community, and caregivers in the public school setting or other large community venues. Public access defibrillator initiatives provide laypersons with instructional courses on the use of AEDs, adding awareness regarding AED access in public areas. Federal and local governments have enacted laws to place AEDs in municipal buildings and areas where there are mass gatherings, such as airports and schools. Studies have shown that these areas represent 20% of all OHCAs. Local initiatives have placed AEDs in public swimming pools, arenas, town halls, golf courses, and other local venues. A big problem is that victims of cardiac arrest in private residences are not likely to receive CPR as quickly as when these events occur in public. Efforts to improve this dilemma involve training emergency dispatch services in real-time instruction on confirming cardiac arrest and performing compression-only CPR. Public Safety Answering Points in Emergency Medical Services. The Public Safety Answering Point, or PSAP, is a call center accessible via a phone number to communities 24 hours a day. It serves as an interface between emergency medical services, or EMS, and the general public. The most commonly known PSAP is 911. Trained community members are instructed to recognize cardiac arrest and immediately activate the PSAP to bring EMS to the scene. The task of dispatchers is to send EMS to assist lay rescuers who are providing compression-only CPR to the OHCA patient. Emergency dispatchers may also help the bystander to intervene in other time-dependent disease states, such as acute coronary syndromes, trauma, and stroke, to increase the victim's chances of survival. Studies show that reducing the time to first compression via dispatcher-assisted CPR improves outcomes. Dispatcher recognition of cardiac arrest. It is important that a dispatcher diagnose cardiac arrest through the phone, even though the dispatcher is not present at the scene. This is done by asking the correct questions of the bystander. Dispatchers must gain rapport and good communication with the bystander for this to be successful. Scripts and guides are developed by PSAPs to assist dispatchers in detecting OHCA. Studies show that scripts developed by PSAPs have a 99% specificity, or the probability that it is indeed a cardiac arrest. One of the most important clinical signs that the bystander has to relay to the emergency dispatcher is the presence of abnormal breathing or agonal gasps. Once detected, the emergency dispatcher may instruct the bystander in performing dispatcher-guided CPR. Dispatcher instruction in CPR. The survival benefit of dispatch-instructed CPR is 2.4%, but there is no evidence proving that dispatcher-instructed CPR improves neurologic outcomes, or ROSC, return of spontaneous circulation. However, the American Heart Association guidelines still recommend that dispatchers provide compression-only CPR instructions to callers for adults with OHCA. The role of social media in summoning rescuers. The systems of care in some communities include phone calls, SMS text messaging, and social media to alert emergency dispatchers to OHCA situations as part of their policies. Social media companies embed messaging services which can be utilized as a gateway to reaching dispatchers and volunteer lay responders. There is a need for instant access to bystander-initiated CPR. Therefore, the use of social media can fill this gap by sending the closest trained lay rescuers to the scene. Studies have shown that response times were faster for bystander-initiated CPR, and that the proximity of lay rescuers to the cardiac event is both necessary and life-saving. OHCA quality metrics and EMS transition to hospital. Data collection and utilization are necessary for quality improvement initiatives. The Utstein Resuscitation Registry Templates for OHCA is a data capturing tool for organizations to use and refer to when building their policies around systems of care. This standardized template incorporates core elements of resuscitation performance for OHCA, community response times, EMS treatment accuracy, and hospital systems of care. Other data, such as 12-lead ECG and CPR quality measurement, are also available. The performance of high-quality CPR improves when providers know that they are being evaluated for their performance all the time. Metrics to measure the effectiveness of CPR include chest compression fraction, chest compression quality, compression depth, compression rate, and allowance of full chest recoil after each compression, and ventilation rate. The feedback provided to these rescuers helps them understand their abilities in providing CPR and what aspects they need to improve. The transition of OHCA victims to the hospital or receiving facility involves EMS providing ACLS. ACLS involves advanced cardiac monitoring, 12-lead ECG, defibrillation or cardioversion, vascular access, pharmacologic interventions, and advanced airway implementation and care. Once ROSC is achieved, the ACLS providers begin comprehensive post-resuscitation care. This includes hemodynamic and oxygenation optimization with volume-limiting ventilation, as well as targeted temperature management. Continuous quality improvement. Bystander CPR, CPR quality, early defibrillation, rapid response systems, and post-cardiac arrest care are areas of focus for continuous quality improvement. Adding high-performing systems in place will improve resuscitation success rates. An effective system of care will benefit the public if stakeholders focus on clarity, discipline, and engagement each time they meet to further improve their policies and procedures. This involves goal setting, a process-centric focus, data gathering, and accountability. Goal setting. Goal setting aims to define what the system of care must achieve. An entity, person, or a system must be held accountable for the success or failure of these goals. These goals are aligned with key performance indicators based on the change expected and a date to be achieved. For example, the American Heart Association 2020 Impact Goals set a goal of doubling of survival from cardiac arrest between 2010 and 2020 from 19% to 38% for IHCA and 7.9% to 15% for OHCA. Stakeholders can be guided using the 4 Disciplines of Execution by Chris McChesney for goal setting. The 4 disciplines include the following. 1. Focusing on the wildly important. 2. Acting on the lead measures. 3. Keeping a compelling scoreboard. And 4. Creating a cadence of accountability. If the systems of care focus on just 1 or 2 of the important goals, then success can be met. An example is doubling the number of states with CPR/AED training as a high school graduation requirement. Affecting change. The stakeholders can be guided in continuous policy improvements by using tools such as the Lean tool, which aims to transform waste into customer value, the 6 Sigma tools to decrease errors, and the Plan, Do, Check, Act tool for continuous small improvement iterations. The stakeholders must agree on the framework to follow. It starts by identifying a priority problem, gathering all data pertaining to the problem, and formulating a root cause analysis. After identifying the problem, the team analyzes it to develop a solution. The solution can be implemented immediately or as part of a pilot testing protocol so that it can be assessed for successes and failures. If it is successful, it can then be implemented as part of the new system of care. This is a continuous cycle where one problem is solved and another is identified. Measurement. Data gathering is integral to goal setting and affecting change. Data represent the structure, processes, and outcomes in OHCA resuscitation performance. The Utstein standardized template for reporting outcomes is one such data gathering tool discussed previously. Data registries are also implemented with other AHA programs, such as Get With the Guidelines Resuscitation and the Cardiac Arrest Registry to enhance survival. Accountability. Providing feedback to healthcare providers on their performance helps them to further improve. They are held accountable for the success or failure of their performance. Accountability is known to be important in creating positive changes within the systems of care. For OHCA, the entity accountable is the community. For hospitals, the entities accountable are the senior executives, chief quality assurance officer, nursing officer, and medical officer. That's it for our lesson today. Thanks for watching, and remember to check out our website at aclscertification.org for more free content or to get certified or recertified online.